So I'm the first speaker. I'm Avi Charlton, as most of you would know. I have been working as a GP here for about 15 years in Montana. And my talk is about insulin-resistant metabolic syndrome and diabetes. So it's a very important topic. This is why we do low carb, is we want to avoid these conditions and many other conditions. So I want to introduce the speakers I've got tonight. So I've got myself, I'm the first speaker. Then there's Helena Kastanis. She's going to talk about introduction to low carb lifestyle. Then we've got Tracey McBeath. Helena's a health coach and Tracey's a health coach as well. She's going to talk about change and mindset. And then I've got Gillian Harvey. She's a nutritionist. She's going to talk about low carb for chronic conditions. So there's 4 talks. We're aiming for about 20 minutes each. So thank you for the sponsors. So I've got these sponsors coming. Simply Swap Foods with Linda. So you can order online for Simply Swap Foods. She's got porridge and mug cake and cupcakes, and I've been having those mug cakes for breakfast with a bit of yogurt. There's egg, there's protein, that's fantastic. And then there's Regretless. So Sue from Regretless is a new cafe in the city.
In the city, oh, okay.
So she's got all these treats you can try out. The keto place there's no people here, but the chocolate is from the keto place. Treats with no guilt. Did Victoria come? I thought she was coming, but apparently not. KO Fitness, there's Bradley. Did Bradley come? There's Bradley with KO Fitness. He's from Scoresby. So he's a gym, which if there's time, he can have an introduction to his gym at the end. So why are we doing this? So this is just to introduce myself. There's my family. There's my husband, Jack, and Max, and 2 dogs. So this is me in a nutshell.
Is that your son?
Yeah.
Oh, good looking dude.
And I've started this low carb journey about 4 or 5 years ago, and I've started to learn about losing weight, gaining health, and improving metabolic health. And about 2 years ago, Tracey and Helena and Gillian, we all started this Facebook group, support group called Low Carb Melbourne, and we've been connected since. So you're all welcome to go to Facebook and join Low Carb Melbourne. We're also on Instagram and lots of other social medias. It's a very supportive community, and you can share your ideas. And how I set up the Low Carb Clinic is so I've been bulk billing GP here for 15 years. I've been incorporating the low carb into the practice for maybe about 3 or 4 years. So when there's obesity, diabetes, I tell people, look, you've got to cut out the carbs because it's not doing you good. So I've been incorporating into general practice for a few years already and getting good results. A lot of people lose weight and a lot of people doing well. Then a couple of months ago, I woke up one day and just not happy, not very getting rewards, bulk billing clinic, people not really listening to me. So I wanted to set up this specialized low carb clinic. So I told the boss, Dr. Takla, who some of you might know, and he said, yeah, all right, go ahead. And I told him I want that room. I wanted to call Melbourne Low Carb Clinic. And he thought, yeah, he was quite happy in the end. So that's how it came about. So I've been seeing patients for the last 4 weeks, 1 day a week first, and hopefully I can build up and get more and more patients. We can do telehealth, we can do face-to-face, and so I'm advertising. So if you see all my emails going crazy, just be patient. I'm just trying to market myself everywhere. So let's get into the nitty-gritties. So we've been taught that weight loss, how do you lose weight? You've got to go exercise, burn all the calories and eat less. Does it work? It doesn't work because your body is not that simple. It's not like a scale. There's so many other things that goes on in your body. And look at all that. This is your body metabolic pathway. there's so many different pathways. Your body's not a scale. It's not as simple as calorie in, calorie out. So there's a Krebs cycle. There's all these chemicals that happens in your body. It's not as simple as calorie in, calorie out. So if you exercise heaps and cut down your calories, if you keep doing that over a period of time, you will get hungry and you will have to want to eat more. And if you go back to eating normally, you will put on the weight and even more. So this calorie in, calorie out doesn't work and you'll just go starving. There is an experiment that people have done to a group of men. They starved these men. These men did lose weight in the beginning, but over a longer period of time, they just go crazy. They keep thinking about food. They want to gather all these cookbooks. So if you restrict your calorie, eventually you will just go crazy. So you've got to learn about this hormone. This hormone is called insulin. So insulin it's essential. So it's a hormone that's responsible in your body to put glucose to become fat. So it's a very important hormone. It regulates the glucose in the bloodstream. It allows the glucose to go into the cell and it stores it to become fat. It breaks down the carbohydrates, the fats, and the proteins. And it's regulated very tightly by your body. Your body is very, very clever. And it's also responsible for growth. So when you grow, you need more insulin. So it's like a key. So when you have the glucose come along, the insulin is a hormone that comes along and put the glucose away and store it into the cell. So what happens when you have too much insulin? So then you get insulin resistant. So insulin resistant is a state in which a given concentration of insulin produces a less than expected biological effect. So your body produces more and more insulin to have the same effect. It's also an inflammatory state and ultimately leads to development of metabolic syndrome. So I'll get into what metabolic syndrome is. So you've got to understand there's 3 types of macronutrients. So macronutrient just means the type of food. So there's carbs, there's fat, and there's protein. So protein is your meat, eggs, chicken, and fish. And the carbs is sugar, bread, potato, pasta, rice. And the fat is like the fat around the meat, butter, avocado, nuts. So what happens is when you eat the carbs, it will raise your blood glucose the most and it will produce the most insulin response. So when you eat the carbs, the insulin has to come in and put them all away into the cells into become fat. The fat doesn't raise the insulin as much and the protein intermediate. So what happens if you keep eating the carbs and keep eating frequently is that you get insulin resistance. So your body has to make more and more insulin to put these away. So what happens is you get tired, you get hungry, you get lethargic, and then because you're not really getting enough energy, you want to have more energy and then you get starving. So you want more carbs, you want more soft drinks. And then more insulin comes out and put them all away. And then the insulin just comes in and put more and more sugar, carbs, put them away, and you get central obesity. So belly fat. And each time you eat, the insulin has to come in. So if you have 3 meals a day and 3 snacks in between, or another coffee with sugar and milk, then that's many meals a day and the insulin has to come in and work more and more often. So a lot of people don't realize the coffee with the milk, maybe the sugar, is another snack. So if you have breakfast and lunch and dinner and you say you don't snack but you have 2 or 3 coffees with milk, those are the snacks. So you've got to be careful with those. And if you have another midnight snack or another chocolate, then that's another snack. So when you lock down, quite a lot of people just keep snacking, grazing, walk around and get another chocolate. So those are the drivers of insulin resistance. So symptoms of insulin resistance, you get central obesity, you get overweight, you get tired, skin tags is little things that hangs off the neck and maybe the underarm. People don't realize this is related to insulin resistance metabolic syndrome. You get hungry, you get brain fog. People don't realize the brain fog is not just busyness, it's part of the sugar just clouding your head. The blood pressure goes up. You get dark patches on the skin folds, especially the underarm or the neck. We call it acanthosis nigricans. Frequent infections. Some people say, oh, I'm getting cold all the time. I'm getting COVID. I get flus and I get urine infections. They don't realize this is all related to insulin resistance. So how do we find out? So I would organize a fasting blood test, and if your sugar is about 5.6 to 6.9, maybe you've got metabolic syndrome. So we're not quite talking about diabetes yet. This is metabolic syndrome. This is what happens before you become diabetes. You can also get a oral glucose tolerance test. This is what the pregnant women get. They get a sugar drink. They get a blood test before the sugar drink, 1 hour later and 2 hours later. If it shoots up and doesn't come down, then maybe you've got metabolic syndrome. You can also measure the insulin with the Kraft test with a similar sugar drink. So a lot of doctors don't know how to organize a Kraft test or a fasting insulin. So I have learned that ordering a fasting insulin can be very helpful. So I have found some people have fasting insulin of 20s or 30s or even 70s, but the HbA1c and the glucose is actually quite normal. So these people are the bodies is making so much insulin that the body is regulating so much, they're maintaining the glucose to be still very good. So the normal doctor just measuring glucose and HbA1c wouldn't find these insulin resistant people. The HOMA IR is also a test that calculates the insulin and the glucose. There's a formula, you can punch it into the website. So, sorry, it's a bit small, but I can put the slides up somewhere. So how do you diagnose metabolic syndrome? You only need 3 out of 5, but quite a lot of people have 5 out of 5. So waist circumference, elevated. So unfortunately for the Indians and the Chinese, you don't have to be very fat to have the risk of metabolic syndrome and diabetes. So the elevated waist circumference is population specific. With the cholesterol level, there's a thing called triglyceride. So if you have high triglyceride, more than 1.7, then you've got higher chance of metabolic syndrome. If you have low HDL, that's a good cholesterol. If you have less than 1.3, then you've got risk of, for women, it's not very clear, but less than 1 for men, then you've got chance of metabolic syndrome. If you've got an elevated blood pressure over 130 on 85, then you've got chance of metabolic syndrome, or an elevated blood glucose over 5.5. So please note there's no total cholesterol or LDL. So we call LDL the bad cholesterol. These two are not in the criteria for metabolic syndrome. These criteria is in the RACGP, it's not in the low carb literature. So it's all widely published amongst the GPs. So again, that's what happens in metabolic syndrome. You get a high CRP, that's an inflammatory marker. So I actually just started to measure CRP in a lot of people. When they have metabolic syndrome, they can have just a niggling high CRP, means there's some inflammation going on. What happens is the food can be inflammatory. Having belly fat, the fat doesn't just sit there. The fat actually releases inflammatory markers and causes inflammation in your body. So there's a good reason to try and lose the fat. It's not really health at every size. I'm not trying to fat shame people, but it's not just sitting there not doing anything. Metabolic syndrome can also cause gout and can also cause fatty liver, sleep apnea, insulin resistant, high blood pressure. It can affect your kidney function. So it does a lot of things. So there's other things that can increase insulin resistance. So high carb diet we talked about, fructose. So a lot of people don't know fruit is sugar. So sugar is actually half fructose, half glucose. So the fructose can only be broken down by the liver. So what happens is if you eat lots of fruit or drink fruit juice, the liver has to work extra hard and store it as fat. When you have fatty liver, quite often it's too much fruit or fruit juice or sugar. Then there's chronic inflammation, infection. So COVID, flus, coughs and colds quite often can increase inflammation. Poor sleep increases inflammation. So if you're lacking sleep all the time, then you can have more inflammation. The gut microbiome, what happens is there's little cells in the gut. So if you've got toxins, they can go, then there's leaky gut. These little cells, the tight junctions open up, and then the endotoxins that comes from the bacteria goes inside your body and cause inflammation and cause problems if you don't maintain your gut health. Then stress can cause inflammation, so you need to manage your stress. Then there's, of course, there's family history, genetics, and genomics, which you can't change. So I like this diagram. There's all these contributing factors. There's food, there's sleep, carbohydrates, sedentary lifestyle, seed oils, is vegetable oil, canola oil, sunflower oil. They all contribute to insulin resistance. Then there's all these conditions that are related to inflammation. We've come to know that cardiovascular disease, heart attacks, are actually inflammatory, caused by inflammation. Strokes, Alzheimer's disease is related to inflammation. Migraines, so if you go low carb, migraines can be helpful. Some cancers, so cancer feed on sugar. If you have metabolic syndrome, quite often increases your risk of cancer. So if you've got cancer, I would really not eat sugar because you don't want to feed any cancer. And arthritis. So sometimes with arthritis, I tell people to go low carb. They don't even have to lose any weight and they get improvement in their arthritis. So it's not about the weight, it's about the inflammation, about the food, about other things. Erectile dysfunction. So men don't know it's not stress, it's not alcohol, it's probably because of metabolic syndrome. And again, fatty liver. Sarcopenia, so if you have sarcopenia means you're losing muscle. If you have metabolic syndrome, inflammation, you lose the muscle, you lose the bones, and you get weaker and weaker, and sometimes the older people don't want to eat protein, and it gets even worse. Or they don't want to strength train, then it gets worse and worse, they get weaker and weaker. Then we get to diabetes. So if you get worse with the metabolic syndrome, then you progress to diabetes. So I'm talking about type 2 diabetes. The type 1 diabetics are a totally different story. I'm not going to go into that tonight. So if you have a borderline glucose, diabetes possible, or we can check your fasting glucose over 7, then diabetes is likely. We can do a glucose tolerance test as we talked about, or an HbA1c, or a random glucose. And these are the risks of diabetes. If you're overweight, over 40, family history, ethnic background. So again, the Chinese and the Indians have, they don't have to be, we don't have to be fat to have a higher risk of diabetes. If you've had gestational diabetes, or if you've had polycystic ovarian syndrome, taking antipsychotic medications, and the Aboriginal and Torres Strait, they are not born to eat the Western diet with so many processed foods. So these are the symptoms, very similar to metabolic syndrome. You get tingling limbs, so quite often we say it's a glove and stocking distribution, so numbness in pins and needles in your fingers and toes. You get thirsty, hungry, blurry vision, high blood glucose, lots of frequent urination, lots of wheeze. So tired, hungry, quite often that's diabetes. Then all these signs, again, there's skin tags, people don't know that's metabolic syndrome, diabetes. The dark patches, again, that's called acanthosis nigricans. The central obesity and the hirsute just means facial hair growth. How do you monitor diabetes? The usual doctors say, let's prick your finger, check your sugar. The diabetes educator said, you've got to check your sugar a couple of times a week, but that doesn't tell you anything. You can get a continuous glucose meter. Some of you follow me in the socials. I've got one on just for fun. So you can follow me on my social and see what I'm doing and eating, and that spikes my glucose because I've got a continuous glucose meter wearing for a 2-week period. It costs about $99 from Freestyle Libra. Type 1 diabetics get it funded, but if you're type 2 or non-diabetic, you can order it from the website, but you've got to say you're a diabetic. You can get a keto meter if you're trying to have a keto diet, which I really love, or low carb. Then you can get a keto meter, prick your finger and see if you're producing ketones. Then you can monitor and make sure you are in ketosis. So that can be quite a helpful tool to make sure you're doing the right thing. You can also, if you prick your fingers, you can also do a chart. You can do it intensively for a week, and that might give you a lot of knowledge on what you're doing and what you're eating and have a bit of a lesson. So if you prick your finger before a meal, prick your finger 1 to 1.5 hours after a meal, and if that rise is more than 1.7, that meal has too much carbs in it. So you can do a chart, you can do it intensively, monitor your blood sugar over a week or 2 weeks or however long you want to see the food. Then you see what the food does to your sugar. Then that might be a helpful exercise for the diabetics or those who want to know what food is good for you, what food isn't good for you. Lots of complications with diabetes. So you can go blind, you can lose your the kidney, you can lose the function of your kidney, nerve damage, and your brain. You can have a stroke, heart attacks, and extremities. We get peripheral vascular disease, so you can get blocked arteries in the veins. People need bypass operations to unblock the arteries in the leg, or you can lose a toe or a foot. And some celebrities that's happened to them before, and it's a terrible complication. But there is hope. This is why we're here. Diabetes can be reversed, or at least controlled, or at least reduce the risk of complication. This is why I'm so passionate about low carb, because we can reverse metabolic syndrome, reverse diabetes. So what do? We go low carb. We eat real food. So we eat protein and veggies, and we stay away from the food that rises your sugar. So the food that rises your sugar is the carbs, the processed food, the sugar, the fruit. So we try not to eat bread, potato, pasta, sugar, processed food, chips, all those things. So we eat real food with meat, eggs, chicken, fish, and I always say prioritize the protein. That's where the nutrient is. Eat healthy fat. So the healthy fat is the butter, avocado, nuts. The fat around the meat is all very healthy. Then there's unhealthy fat, which is the processed oil, the seed oil, vegetable oil, canola oil, sunflower oil, margarine. So avoid all those because they can increase your inflammation. Eat less frequent. Eat only when hungry. So if you go low carb, quite often you become fat adapted. You don't get hungry anymore, which is actually quite fantastic. And you don't have to eat all the time. So at least avoid the snacks. Eat 3 meals a day and avoid the snacks would be great. If you're not hungry, you can skip your breakfast and then you can go to work without rushing around. Some people aren't very good with fasting, which I am one of them. But not eating the snacks is a fantastic thing already. So eating this way will reduce your inflammation. Quite often the aches and pains go away. Some people have niggling non-specific symptoms like coughs and snotty nose. And sometimes I go to them, hey, how about you try low carb for a month? You've got this cough for 2 months. How about we try this? And the cough goes away. Strength training. So we've got a gym owner here. So strength training is so important. So sure, walking is fantastic, but it's not really building muscles. So strength training doesn't have to be hard. You just do some squats or deadlifts, build it up, and quite often that can increase your muscles and improve insulin resistance. Thank you. That is my talk. Just a tiny bit over time.